Welcome back to Coordinating Clinical Trials. My name is Steve Pope, and in this lesson, we're going to be talking about subject recruitment. So, let me just start out by saying that probably as many of you know, one of the most common reasons why clinical trials fail is due to not having enough subjects enrolled. So, in your role as the clinical research coordinator, you're going to be involved in subject recruitment. So this is a critical step that involves identifying, attracting, and enrolling suitable subjects to take part in your study. So a successful recruitment ensures that the trial has enough participants to achieve its scientific objectives. As we said, many trials fail due to lack of qualified subjects. So in this lesson, we're going to be discussing subject recruitment along with successful strategies for improving subject recruitment so that that doesn't happen at your site. Let's look at our learning objectives. First, we're going to discuss subject recruitment strategies. We're going to cite challenges to subject recruitment. We're going to define the screening and consent process, practice a subject recruitment strategy, and then finally we're going to identify regulatory and ethical considerations as they relate to subject recruitment. So there are a number of elements of subject recruitment that we're going to discuss in this lesson. They include target population, recruitment strategies, screening and consent process, challenges to recruitment, regulatory and ethical considerations, technological support, and post-recruitment. So we're going to go over each of these elements and let you have a better understanding of each one and how they're going to relate to what you're going to do at your site to bolster your subject recruitment activities. So let's talk about the target population. Every study that you work on is going to have a target subject population with some parameters around it. So the way we identify these and the way we work with these in our recruitment strategy is through the inclusion-exclusion criteria. So let's take a look at each one. So inclusion criteria includes characteristics that participants must have to be eligible for the study. They might include age range, gender, disease type, the stage of illness that they're in. They probably need to have some sort of a diagnosis of the disease indication that we're studying in our clinical trial. There's also going to be exclusion criteria. So these are going to be characteristics that disqualify a participant from participating in the trial, and these could include certain health conditions that they may have. They might have previous treatments that they've been involved in that could be exclusionary, or there might be demographic factors that make them ineligible for the trial. So having a good understanding of these is going to be key to your recruitment strategy. These are going to be detailed in your clinical trial protocol. There's going to be a section there that details each of these inclusion and exclusion criteria, so you'll have a good understanding of what they are. So let's talk about some of the recruitment strategies that you may use at your site. One of the first ones is going to be community outreach. This involves engaging the local community through health fairs, community centers, and local media. You also may have digital campaigns, which include using social media, websites, and online advertisements to reach a broader audience. Now, it's important to understand that these activities need to be approved by your IRB before you deploy them. So, for example, in digital campaigns, if you're going to post ads on Facebook or Instagram or some other social media site, that needs to be approved by your IRB before you do it. Another strategy can be use of healthcare providers, such as collaborating with doctors and clinics to refer eligible patients. You may notice sometimes when you go to the doctor or you go to the clinic, they may have a poster there that advertises a clinical trial that they're recruiting subjects for. It may be someone in their clinic conducting the trial, or they might be helping out another site to help them identify participants. And once again, these also need to be approved by your IRB before you deploy them. But they can be very, very effective because you see a lot of patient eyeballs in that kind of situation, and it doesn't cost very much to do. Another area could be patient registries and databases. These utilize existing databases of patients who have expressed interest in participating in clinical research. A lot of hospital-based trials may use these where they can actually go into their electronic medical record and do searches, and they can potentially identify subjects that might be good participants for their trial. And then they can contact them and find out if they're interested in participating. One other strategy is going to be advertisements. This includes placing ads in newspapers, on radio, TV, public transportation, etc. Newspapers, do people still read newspapers? I guess they do. If you're looking at an older demographic, that could be a good area, could be a good place to place your ad. So understanding the various strategies can be key to helping you be successful in however you choose to deploy them. So the next element is the screening and consent process. So you're going to have a pre-screening area where you've got initial assessment being done to determine if potential participants meet the basic criteria. This might include using a telephone script, for instance, as people may call into your site and inquire about a study. You may have a couple of questions you want to ask them. Usually these are probably going to be sort of knockout questions that would exclude them from the study based on what their response is. So this could be, or you can have like a pre-screening questionnaire that you might use. The second piece of this is the informed consent process, and I emphasize the word process because informed consent is the process of providing detailed information about the trial, including its purpose, procedures, risks, and benefits, to the subject, and then obtaining their written consent once they've been given all of the information about the trial and they've been given a chance to ask questions about whether or not they'd like to participate. So it's important to understand that the informed consent, it is a process. It's not simply a signature on a form. So let's talk about some of the challenges to recruitment. So we've got a couple here that we want to discuss. First of all, awareness and understanding. Potential participants may not be aware of a clinical trial or may not understand their importance. So that's going to be a key area that you need to create awareness for in your recruitment campaign. Trust. Concerns about safety and ethics of clinical trials can hinder recruitment. We've all heard the stories of unethical clinical trials that have occurred mostly well in the past. I think we've kind of gotten beyond that now, but in certain populations there is an element of trust there that they just don't trust participating in a trial. They think they're a guinea pig, and they think there's something negative about it, that something's going to be done to them that is not going to be in their best interest. So that can be a barrier to recruitment. Eligibility, stringent inclusion-exclusion criteria can limit the pool of eligible participants. So remember back in our lesson on planning research, one of the things that we talked about was choosing trials where you're going to be able, or you feel confident that you're going to be able to enroll the number of subjects that the sponsor wants you to enroll. Sometimes trials have very narrow, very tight inclusion-exclusion criteria, and it's going to be difficult for a lot of your patients to meet that. And so that can be a challenge, and you need to be aware of that as you start to assess whether or not you want to participate in the trial at your site. And finally, retention. Keeping participants enrolled throughout the study is a challenge for a number of reasons. They have the duration of the trial may be lengthy, subjects move away, you lose contact with them, they may experience side effects or adverse events, and they don't want to participate any longer. They want to stop, which is their right to do. So be careful in those. If you're looking at trials that are going to last a long time, particularly if that subject is going to be participating for a year or more, you're probably going to run into some areas there where retaining them is going to be a challenge. So you've got to figure out some strategies for doing that, and then that helps you in your recruitment effort. So you have some regulatory and ethical considerations that need to be part of your recruitment effort. First of all, you've got ethics committees or institutional review boards that oversee what you're doing on your recruitment effort. Remember when I said those Facebook ads need to be approved by your IRB? That's what we're talking about. So they want to make sure that there's no coercion going on, that you're being honest with the trial criteria, and that you're not providing information that's not in accordance to the trial protocol. So they're going to be overlooking that and making sure that you're doing the right thing. Confidentiality, ensuring that participants' personal and medical information is kept confidential. So if you're searching for patients in your electronic medical record, for instance, you need to be aware that you're keeping their medical record confidential, and that it's not out there where others can get access to it. Finally, compensation. Clinical trial participants, they're compensated for their participation in the trial. So it's important to understand that this compensation is really to compensate them for the time that they spend on the trial, and for maybe travel if they have to travel a distance to your site. The important thing is that this cannot be an unduly influence or be coercive in any way that provides an inducement for them to participate in the trial. And these compensation levels, yes, they're going to need to be approved by your IRB, and they are part of the consent process as well. So the subjects will know what kind of compensation they can expect from the trial. Typically, if they're participating in a trial that might last for 8 or 9 months or so, their compensation probably isn't going to exceed maybe several $100s. So it's not an enormous amount of compensation. Now, I know you guys are probably familiar with stories of participants that do this essentially for a living. In most cases, probably in every case, those are going to be phase 1 clinics where they're using healthy volunteers. They've got them sequestered in there for a period of 4 or 5 days or even longer, in some cases. And so those compensation levels can be a lot higher. They also restrict the number of those types of trials they can participate in over a period of time. They may be limited to one every 30 days or every 45 days or something like that. So once again, this compensation level needs to be approved by your IRB before you can, start paying it out to your subjects. So technological support, as I mentioned a moment ago, many sites use their electronic health records to kind of scan for potential participants. You can do this if you've got access to an electronic medical record. If you're a hospital-based site, you would very likely have access to that. Now we're seeing a lot more AI tools that can assist in this area. They can take, you can deploy an AI tool that can scan multiple medical records and extract certain data from there that might identify a potential participant. So we're seeing more and more areas, more and more technology solutions in this area. Telemedicine, using telemedicine for remote recruitment and follow-ups. That can be a retention tool. Being able to access subjects via telemedicine. This was big during COVID when a lot of participants weren't allowed to come in for the visits. We had to do them remotely. So that technology is out there and it's getting easier to use every day. There's also mobile apps and wearables. These will be smartphone apps and also some of the watch technology that's out there. These can be used for recruiting efforts as well. Once again, got to be approved by your IRB before you deploy it though. So post-recruitment, we kind of talked about retention strategies a moment ago, but this essentially is maintaining engagement or contact with your participants through some type of regular communication, providing updates on the study, ensuring a positive experience. This can be staying in contact with them via phone or via some type of smartphone app where they can receive updates on a regular basis. Maybe they get a text message once a week or once every 2 weeks. For instance, you might send them a text message reminding them to fill out their dosing diary if they're using a dosing diary on your study. Appointment reminders, appointment cards that help them remember when their visits are. All of these things are recruiting or retention strategies that you can use, and they can be very effective. And if you're working on a long-term trial, you need to have some of these retention strategies because there's a good chance that you're going to lose contact with some of these study subjects. Following up, monitoring the participants' health and collecting data as per the study protocol. For instance, you might be required to conduct a phone call every 30 days, for instance, with your subject to assess adverse events and any new concomitant medications that they might be on. And of course, those would be entered into the EDC database, like we talked about in one of our previous lessons. But keeping in contact with subjects is very important. In the event that you lose contact with subjects, you probably will have some subjects that you lose contact with. They're going to be deemed lost to follow-up. So the appropriate thing to do is to send that subject a certified letter indicating that you've lost contact with them, asking them to come in to contact the clinic, contact your site, and then some sort of return receipt request should be sent along with the letter so that you know whether or not they received it. In the event that you do lose contact with them completely, then that subject is probably going to be withdrawn from the study. They're going to be considered lost to follow up, and you're going to have to enter that as their final status in the EDC database. So let's take a look at your reading assignments for this week. You've got a chapter from your textbook, chapter 9, which discusses subject recruitment. I've also put up a couple of articles here, several, that will kind of amplify what we've gone over in this lesson and give you some additional information that can be helpful for you when you're putting together your recruitment strategy. And then finally, what I'd like you to do for your discussion forum assignment for this lesson is you're a clinical research coordinator working on a new treatment for GER, gastroesophageal reflux disease. So your study sponsor is concerned that they will not enroll the required number of subjects to meet the study requirements. So I want you to identify and discuss a recruitment strategy that you can use to boost enrollment at your site. And I'd like for you to discuss this strategy using fewer than 200 words and post it on the discussion forum. So think about what we've gone over in the lesson. Think about the disease indication, how you might go about identifying subjects, and then kind of give me a synopsis of how you would go about doing that. Post it on the discussion forum.